Welcome back to AI Med Talks here at the AI Med Conference in Sydney, a first time for Australia. And I have one of the speakers here with me today, which is Professor Karin Verspoor from the University of Melbourne, who's here to talk about her experience with AI Med and why she's passionate about being part of the movement. Thanks for coming and chatting to Alexia on AI Med Talks.
Thanks for having me.
Now, tell me a little bit about what you're going to be covering today in your chat and the information that you're delivering and why you think it's so important that people are part of this in the healthcare sector in Australia.
I'm going to be talking about some new experiments we've been running to try to model what happens to patients with atrial fibrillation when they're treated with a drug called warfarin. And essentially, there's a subset of patients that respond quite negatively to warfarin. They either have bleeding in the brain, or they have a stroke, or they can die in the worst case. And we're trying to develop an algorithm that can identify those patients so that basically they can be not treated with that drug. And if a patient comes in that shares characteristics with those patients who respond poorly, that they can avoid the drug.
And that information is obviously heavily aggregated, and the information is used, I guess, for want of a better word, for the greater good, rather than just thinking about the patients on an individual level, which we're always thinking about in healthcare. But in this case, that's how it can be utilised.
Well, the objective here is to design a tool that can be used for an individual patient, responding and recognizing their individual characteristics. The way we build the algorithm, of course, uses lots of data. In this case, we're using data that's been collected in the UK called the Clinical Practice Research Database. And indeed, it's completely de-identified and it protects the underlying individuals. What we're really interested in is in the patterns of care that have been provided to the patients. And what we're looking for with the algorithms is to try to identify essentially patterns of symptoms and diseases that are predictive of this bad outcome that we're trying to avoid.
And can this be utilised across a number of different issues and diagnoses, or is it really something that's quite specific to only certain sectors of healthcare and the journey that the patients are on?
So the algorithms that we're using are quite general. We're using machine learning models, including support vector machines and naive Bayes models, which are pretty commonly used and have been used for decades, really. We're also starting to explore the new deep learning models that you've probably been hearing about. And so the tools themselves are quite general. What's not general is the specific use case we're looking at. And so the actual tool that we're developing through this will be tailored specifically to that question around, should we prescribe warfarin to this atrial fibrillation patient in front of me.
But then the use of the data and the way that it's, I guess, utilised can be used across lots of different parts of healthcare in the way that drugs are used.
Yeah, absolutely. So these algorithms can be tailored to all sorts of clinical research questions. Once we have the data available to us and we have worked out the best way to kind of utilize the algorithms to explore that data, then we can sort of arbitrarily create clinical research questions that we can then use the data to answer and then subsequently inform decision-making around patient care.
Now, why AI Med? Why are you so happy to come and speak to an audience like this? And what do you think this audience is going to get out of what you're delivering?
We're at a point where medicine is being transformed through data. And what I'm excited about is getting people excited about that opportunity. It's really a point change in how medicine can be practiced by leveraging the experiences and the care history of hundreds of thousands of patients, potentially millions of patients worldwide. We can really gain insight into how people respond to treatment, what the best treatment options are for people. And it's really, an exciting new world that we're entering into where these algorithms can support the clinical decision making and not just rely on the experience and the training of an individual clinician.
And you raise a really good point there when you use the word world, because we are living in a smaller and smaller, closer knit society in that we're sharing data and sharing information. Is that why something like the AI Med movement is so important to be part of the healthcare landscape into the future?
Absolutely. We are part of a global world. And at the moment, there are opportunities to leverage information that we're not taking advantage of. And by essentially making the data that we're collecting here in Australia ready for sharing with the world, that allows the world to help us understand our data. So we have this kind of win-win. We give a bit of data and we get back some insight that we can leverage from other data sets from around the world.
Because I guess even though we live in different countries and all of the different countries have different healthcare needs and strengths and weaknesses, we are at the end of the day all human beings.
Yeah, and actually by leveraging populations from around the world, we can address some of the variability that we have in our local population. So actually, Australia is quite small, as we know, and but yet there's diversity in the population. There's ethnic diversity. Increasingly, we have people moving here all the time, and so that raises questions around how to treat these patients, because it's not obvious that a patient that has one ethnicity should be treated in exactly the same as a patient that has a different set of experiences, a different ethnicity. And so by sharing data and leveraging data from around the world, we can start to understand, is ethnicity important? Maybe it is, because it could be impacting your genomic composition, for instance, which of course interacts with how we respond to medication. And so by expanding our horizons, we can actually do a better job of tailoring the kind of treatment we give to the people right here.
And it's like you're thinking of the greater world, but also thinking of the patient on that one-on-one level as well. And I guess that's the beauty of AI in the future of healthcare. Where do you see Australia positioned compared with the rest of the world? Are we in a good position? Do we need to work harder at it? Who do we need to bring to the table to improve that conversation?
We unfortunately are still lagging a little bit behind the rest of the world. Step one is that we don't have a national system for sharing data and representing that data and making it available to algorithms to look at. And so that's one challenge that we need to face. AI doesn't work unless it has data, really, because we have to look for the patterns in data. And so you need to have sufficient quantities of data to support that. So we need to work on capturing that data, making it available, making it interoperable between multiple hospitals across the country, and of course interoperable with the global data that's being collected elsewhere.
Do you think that's the main challenge, just making sure that is all shareable and useful across so many different systems and processes and servers and locations? I mean, it seems to me an almost unachievable feat, but you're sounding quite positive.
Yeah, no, we are making progress on that. So there are examples of standardized vocabularies and standardized representations of data that have been developed, and they're increasingly being used across Australia and around the world. And so organizing that data, making it available in these kind of standard representations is necessary. It's not sufficient, of course, and I think we still have a lot of work to do, and that means not only here, but more broadly around the world, on the algorithms and what is the best way to manage the complexity of this data. Because AI algorithms are really good when we have a well-defined, discrete task, and when the data is very dense. So, for instance, the image processing algorithms are performing better than humans in some cases. And that's because they have a nice, consistent data source. An image is always an n by m matrix, 1024 by 512, with pixels and values in every one of those. When you start looking at patient representations, it's much more complex. You have hundreds of thousands of possible symptoms and diseases that patients might have in a time series. So you have patient visits that might involve 10 symptoms, and then they go to the doctor 20 times over the course of a year. And so all of that variability and complexity is something we don't quite know how to handle yet with our algorithms.
And that's what I suppose the AI med movement is going to support, is having those conversations globally and talking to experts around the world, such as yourself. Look, thank you so much for joining AI Med Talks today. We're looking forward to hearing you speak, Karin. And how can people find out a little bit more about the work that you're doing?
So most of the work that we're doing is in the framework of a training center down at the University of Melbourne. It's at aimedtech.org.au, I believe, is the URL, and that's probably the best place to go.
Fantastic. Well, thanks for joining us today.
Thank you.